executive committee of the Troy Chamber to have us present to them.
Thank
And
you.
if you have any questions along the way, ask them. That will help them in at least responding to the program today. This is Mike Fitzgerald, and I'm Ram Yusoli. And many of you know me because I've been with and started working with the TDC back in 1995, and then worked with the Chamber and set up Troy Career Connect, and so I'm very familiar with both the Chamber and the
We
organization.
have a little history.
Yeah, it's right. A little history. Most of it good. Most of it good. And Mike can sort of give you an overview of what Healthcare Advisory Network is and what we do.
Yes, I'm Mike Fitzgerald. I'm one of the consultants for Healthcare Advisory Network, along with Ron Musili, and we have a team of about almost 20 right now. We're growing quite a bit. And we are a local group in Dayton, Ohio. We basically touch almost every facet of healthcare there is, from healthcare technology to integrating new technology to physician relationships, contracting, acquisitions, relationships, and we work nationwide with many different facets. And today we actually have a healthcare coverage service we want to talk about. It's very exciting. It really works well with employers and helps employers dramatically improve the retention of their employees, which is just an ongoing
Yes.
horrible issue we're all
Very
dealing with.
important.
When the job market gets better, it's easier to go where the street and get another position. So, Ron, you want to talk about BasiCare Plus a little bit?
Sure. We got together with a gentleman named Brad Mullen, about 3.5 months ago.
Yeah, we were working with Brad for a couple of years ago on some telemedicine interaction and integration of new technologies. Got to know Brad, fantastic guy.
And about 3 months ago, he came to us with a new program that he had called BasiCare Plus. And this is, and I had the executive summary up there, but what is it? It's a health service that leverages technology to deliver affordable care. It's not health insurance, but it covers many of the things that the people normally can't afford, or if you look at it as a supplement to what an employer has. Oftentimes, somebody's kid will come down with a fever on a Friday night, and where do they go? Urgent care or the emergency room, and $500 to $1,000 out of their pocket, right, for a simple prescription or a simple calming tone from a physician. Well, what BasiCare Plus does, it provides that individual with the opportunity to call a physician. They in turn will get back with them, go over the issues with them, and identify what the condition is. And if there is a prescription needed, they can write the prescription. You can go to a number of places, Walmart, CVS, Rite Aid, etc., and get your prescription done. So this is a much faster process, and I think as Mike talked earlier, it's a great retention program. We're finding a great retention for employers. They're having a tough time holding on to people. We're finding people.
Yes,
and
they are.
as we see as we talk through it, the cost of this and the process is very simple and very affordable. Let me take a quick look at, I'll show you the retention turnover reduction study that was done back in 2017. And this is for respondents who's had an average wage at that time of $9.03. So that was average. Obviously, that can be as high as 14 and as low as 7 or 8. Average time in the job was 9.2 months, and 68% indicated they have no health coverage or limited subsidized health care. So a lot of employers today don't provide health care coverage, or they provide a limited coverage, or their deductibles are so high that they're struggling to find a way to use that. So when they asked these people what were they like, they asked about dental, vision, life insurance, healthcare access, and pay raise. All right, those are the top 5 things that they thought were the most important. So if your employer gave you this benefit, which you prefer, so they had healthcare access, pay raise, dental, vision, and life. Actually, healthcare access was the largest indication from the individual what they would like. We'll go down here. So employers participating in the survey indicated they internally calculated the cost of training a new employee. We know that retention costs are high. And I think that number is pretty accurate. It's about $1,800 to bring somebody onboard them, train them, get them going. And so when they leave, you just spend $1,800, all right? So the average turnover rate for the studies was 83%. Now we know it's ranging as high as 90%, some industries 100%, some as low as 50%. But anyway, there is a turnover rate. So if you can reduce that turnover rate even by a few percentage points, you're saving a lot of money. When the study was done, so they found that the turnover rate reduction was about 15%. So you take 15% of $1,800 and you multiply that by the number of people that left, and you can see from the study that was done that the location net savings was $14,000 for an average number of 82 employees. So if you take a look at F&P America or Clopay that are turning over 800 employees a year, okay? This is 82 employees at $14,000 for 800. We're talking about $140,000 in savings, okay? And so that's why this is a great retention program. And to show you why it's a great retention program, we'll discuss it, what the price is and how it works. Mike, you want to?
So, yeah, BasiCare Plus, we stress this, it's not an insurance. We're not brokers. Brokers just add another layer of cost to this. But it is designed for employees to be utilized by their employer. This all came to fruition because of the owner, Brad Mellon. His family actually befriended somebody that was working, a single mom with 2 kids, working 3 jobs. And then years ago, Obamacare came out. So she went from full-time to part-time and with no health care coverage. And he thought there's got to be a better way. There's got to be a way to keep the cost down, yet give somebody enough coverage or service that they can really help their family, something that really is meaningful and powerful. So it comes out that about 82% of all physician interactions can be solved through telehealth. So what the program does, it takes telehealth through a patient's phone, and it can be a voice or a video chat, and they go through MD Live, which is the largest, I think it's actually the largest healthcare physician network out there in the U.S. They do 24/7, unlimited times, and they have an interaction with the physician. Physician says, okay, well, you need a amoxicillin. Sounds like you have a bad bronchitis, so we're going to send you to a pharmacy. And it can be any Walmart, CVS, any pharmacy that the patient wants to go to. And the patient goes there, and all the generic drugs are discounted. And then we took the top 80% of the most commonly prescribed telemedicine medications, and those are free and included. And we just added prenatal vitamins with folate, which is real exciting for us, with no copay whatsoever. Now the big kicker, the thing that really is just fantastic, is that it's for the employee and the employee's family, up to 9 members of a family. Wow. Brad is not a healthcare person by his background. He's an actuarially type person, accountant, so it's all about numbers. We don't sell to individuals, we sell to companies. So it's a fantastic way to keep the employees working, keep them healthy, take care of their families, and as most employees are out there working multiple jobs, that will be the last job they will leave if it's covering the entire family. So we're working with Chambers. We love to work with Troy, and we will have the way that's set up is we have a separate website, and it would be something like basicareplus.com/han/Troy Chamber of Commerce or whatever. The company would go through that website, get a discounted rate. So instead of $8.75 for each employee every month, it would be $8.25 for each employee every month. We would bill the company, and there would be a proceeds that could go back to the Troy Chamber of Commerce about, well, usually between 1.5% and 2%. Goes right to the chamber to keep the program moving and to utilize for other things.
So we put the website out for you. We help you market the program, and then every time they sign up, you're going to get 1.5% to 2% of the total billing. which is really a nice deal.
That's very nice.
Very nice. And so we don't do this for everybody, obviously. We are looking at the Chamber in Dayton, Springboro, and Pickwa's looking at this. So obviously we'd like to get this out here first if we can. There are a couple of chambers around the country that are using this.
Mm-hmm.
They're not as big. The other thing is you can incorporate this into TDC.
Mm-hmm. Absolutely.
Because most of your TDC members are chamber members anyway.
Mm-hmm.
But it's another selling point. And they're the ones that are really struggling with retention.
Mm-hmm.
So we feel it's a win-win proposition. At even at $8.75 a month per employee for the family, it's less than $100 a year. Okay, and we look at the retention. For every person they save, they're saving more than $100.
Mm-hmm.
They're saving $1,800.
Yeah, the interesting thing is that we're finding out that companies will have various levels of coverage. So you have individuals who are part-time, who have no coverage, which this is perfect for. Then you have sometimes executives who have lots of insurance, but their copay is so high, this gives them free telemedicine service that they don't even have. And it's a lot more convenient.
Mm-hmm.
I like it because I have a daughter who's in Ohio State right now, and she can get online and get everything's taken care of, and I don't even know about it until I hear about it later on. But it's such a great service, and it's something that really does. It puts the employer in a different light for that employee.
Absolutely.
And because MD Live is behind this, driving it, and there's such a large organization, they're allowing us to utilize their physician base and their administrative program. So we don't have to start from scratch. They've been doing it for years. We take advantage of their already existing operation.
And we do have a customer service hotline, and that is based in Boston and Kentucky. Everybody's based in the U.S., so we can understand each other.
All
And it's
English-speaking
this is
customer
very
service
important.
people.
That's very good.
And we're not out there trying to. Everybody's getting rich. It's really focused on helping these people get the coverage they need, and they need health care. If they're a single mom with 2 kids, they don't know this kid's sick until they all get home at night. Everybody's closed. This way they can actually end up just going to CVS in about 20 minutes and pick up a prescription.
And for employers out there that have either, they're working with trucking companies or have their own trucking companies, and BasiCare Plus is working with a number of large trucking organizations around the country. And it works really well because they track them. When they make the call, they know by the GPS where they're at. And because Walmart is a trucker-friendly organization, they'll go ahead and send that prescription drug to Walmart so the semi can pull in there, get their drugs, and go on the road.
Nice.
Truly helpful.
And we also have a new product now for colleges. It's $29 per person per semester. And the semester is 6 months long, so basically 2 semesters is $48. So for your child, if they're out there, this is a great opportunity. So we're talking to colleges and universities. I'm currently talking to Indiana, Wesleyan, Anderson, and a few other schools, just because it's a great program for them.
Mm-hmm.
Yes.
So we keep coming out with new programs and products in order to capture those particular segments that are out there. Again, summarizing all of this, for the chamber, we would set up a website. You could then market it. We would help you with that process. They go in and enroll. We do all the enrollment and the billing, and then you get 1.5% to 2% of the billing.
So,
And instead of $875, it's $825.
Mm-hmm.
so some of the common questions we have are: does everybody have to sign up? So the chamber has many different companies that are associated with the chamber. They don't all have to sign up, but a company would have to designate a group of individuals. They would all be signed up, and those individuals are tracked because we through our service. And if someone leaves the organization, they no longer are covered.
Mm-hmm.
It's a retention piece. But they are, the company is billed every month for those. Most of our companies actually have everybody, including the executives, now covered. It's so inexpensive, and it's just worth it.
And for employers that don't provide healthcare coverage, they can provide this because it's not healthcare coverage. So it doesn't impact them on HIPAA and the other relationships out there. This is wonderful.
You mean like the chamber?
Like the chamber.
Like the chamber?
And it really does add an awful lot of value to the chambers. That's one of the exciting pieces.
Yeah,
So,
absolutely.
what other questions do you have for us?
Well, the trucking piece, I think that was one of the things that we talked about a little bit, was the pharmacy, because so many times pharmacies are closed. So that works the same way, like they can target or let you know of a pharmacy that would be
They
open,
know-
like if it's after 10 or
What-
if it's midnight, things like that.
When you enroll, there's an enrollment form. So when any individual is going to enroll in this, so they're going to have some basic information about you, including the zip code where you're at. So when you call in, they automatically know who's calling in, where they're from, they pull up the data, they know what pharmacies are open in your area 24/7. They're going to say, okay,
So
you
they
can go
target
here,
everything.
here,
They
and
do.
here.
That's nice.
And it's all Walmart's, Kroger's, CVS's,
Nice.
Walgreens, just 65,000 different pharmacies. What's nice is we're already doing this. I mean, I go to Walgreens and I can utilize this to go to Walgreens. I don't have to educate or re-educate anybody. MD Live's a fantastic organization. Nationwide, they're all board certified physicians. And then even with the way we're setting individuals up with the company, there's really not a lot of work that has to be done by the company. We can either get information via paperwork, or there can be a phone conversation with that employee and our customer service registering everybody involved. So if they have, say they have an aunt or an uncle living with them, they would call our customer service and say, I've got 2 kids, an aunt, and an uncle, they're all the same residence. That's fine. It's under 9, they live in that same residence, we'll sign them up, and then they have a questionnaire of kind of give a brief background on what to expect. So when that person calls for the emergency, there's not a long discussion. It is,
Nice.
okay, so you're calling about Ricky, and Ricky's not feeling well. We understand, let's have a conversation.
Nice.
And because you can either use a FaceTime approach or you can use Skype, that the physician can actually see the person, look at them rather than just talking to you about them. Moms like that because it's
Yes.
a little more heartwarming kind of a thing. So it's a great tool. That's why you call it telemedicine.
Yep.
Okay. So it's not that expensive. It's a great tool. It's a great retention product. More importantly, for employers that don't provide health care, it's a great product to have.
Absolutely.
It's just something that people aren't going to get, at least at that price. And again, we're going to discount that for the chamber members and TDC.
And easy. Yeah. Nice. So what would the chamber need to do to get started?
Say yes.
You say yes. That's it. You say yes, and we get the
We're saying yes.
We're
get
just
the website
signing
up.
like just signing a contract, and then what's the time period to get like website up, marketing materials?
Within days.
Oh, nice.
We already have marketing materials ready to go.
Yep.
Okay.
We can do a website within days. It's really copying one website that we have. Then it's going to be working with the chamber on how do we communicate with your members. What's the most effective way? The good part is we're all local, and you know Ron very well.
We do.
And I think Ron's going to be.
I mean, I can be more than happy to go out with your people too and
Yes.
talk to the individuals.
Yeah.
Go with Joe, go out with the
Yeah.
chamber, the executive members of the board. But if the board says yes we're gonna see them Thursday, right? They say yes the week afterwards, we'd be up and running by Thanksgiving.
Okay.
So you'd have it yet this year going, and it's a good time of year to get into that, start doing it.
Yeah.
Because before you get into January, there's always that turnover process that happens over the holidays. So you catch them now, get them all in there, and get them going.
Right. Absolutely. That seems like a no-brainer to me. I'm not the decision maker though. But for me, like Matthew actually went to the emergency room today, so. And cha-ching, cha-ching.
Is that your son?
That's my son, yes.
Is he all right?
He is all right. It turns out it's like sciatica, but which doesn't
Ouch.
not normal for I think or common for a 23-year-old, but
Well, I mean,
I don't know. I heard mine.
You do?
Yes, I did. At that
yeah, I might be that bad parent who's been like, you're fine, you're fine,
No,
you're fine.
It's always tough to diagnose.
even with an
Yeah,
insurance program, you walk into an emergency room and it's $500
Yeah.
just to walk in.
Yeah,
And
absolutely.
it's not unheard of to walk out with a $3,000 to $5,000 bill
Yeah.
for nothing. And the insurance is going to say, well, what's your deductible? Well, it's $3,000. Well, you can eat it.
There you
right?
go. Yep.
So that's a pretty expensive trip to the emergency room for something that would cost you $8.75.
Yeah. Yeah.
Yeah, so let's just say that he would call up MD Live at that point, and he's talking to one of our doctors through BasiCare Plus. There's no cost for that at all, man. It's gonna be, well, we can't treat this here. What you wanna do is go to the urgent care, or let's recommend a primary care provider or someone else who can help you. There's not a bill that's coming in the mail. It's free. It's covered.
Anyway, they may say, you know what, you've got something that can wait till tomorrow before you have to go.
Right.
Or here's some medication you can take, or we can go to the pharmacy and get something, that kind of a thing.
Yeah.
Obviously, they're not gonna prevent you if you just wanna go anyway. They're not
Yeah.
gonna stop you from doing that. That's not their
Yeah,
goal.
and they couldn't give controlled substances.
Right.
They can't,
Right.
which is very
Yeah.
important for safety.
Yeah, absolutely.
So, again, we will have the chance to talk to the executive committee on
Yeah,
Thursday morning at 8.
absolutely.
But
Yeah.
at this point, they'll have looked at this, you've asked questions, they should be able to say maybe a couple more questions and whether or not they wanna move ahead with
Well,
this.
they may want to say like, okay, get the chamber signed up. How do we sign up with their businesses? They may be ready to roll too. So,
Yes.
yeah, absolutely.
And they're all employers, so they've
Yeah.
got, you know, this is something that's important to them.
So do we wanna leave some flyers so they
That
can
would be
review
great.
that?
Yeah, that would be absolutely
I got
great.
extra. You got some? Yeah.
And that way, on the back of the flyer is